आप लोगों का हैव यू हैड अ गुड टाइम? गुड। अच्छा, दूसरा ये कि इसको मतलब ये कंटिन्यूस प्रोसेस है। यहाँ से आप जाएंगे तो ऑब्वियसली जाने से पहले मेक श्योर कि आपके कांटेक्ट डिटेल आप प्रोफेसर साजिदा को दें, क्योंकि वी वुड लाइक टू कीप इन टच विद यू। अभी भी मेरे पास आपके काफ़ी जो पहले आपसे जिनने कोर्स किए हैं वो सब मेरे पास फेसबुक पे भी हैं, व्हाट्सएप पे भी हैं, और अक्सर कोई एडवाइस के लिए लिखता है कोई क्या, तो इट्स ऑलवेज गुड टू बी इन टच। आपने मतलब फर्दर ट्रेनिंग करनी हो, वो करना होता है, जो भी होता है, तो वी आर ऑलवेज देयर फॉर यू। काउंसलिंग की ज़रूरत हो, बाहर फेलोशिप किसने करना हो या बाहर जाना हो, तो वी कैन ऑलवेज प्रोवाइड गाइडेंस। मतलब आई बीन वर्किंग इन NHS फॉर वेल ओवर 30 years। तो ये मतलब वो है कि और एक हमारा एक वो भी बन जाती है ना, जो ग्रुप या बिरादरी या जो भी कहें ना, तो इट्स ऑलवेज गुड टू हैव अ दैट टाइप ऑफ ग्रुप। वेबसाइट बना रहे हैं ये हमारे हम में से जो कंप्यूटर जानते हैं तो वो शहरियार है। मुझे बहुत बेसिक, मेरे IT स्किल्स बहुत बेसिक हैं। ईमेल तक भेज देता हूँ, लेकिन बाकी वो हो जाता है। दूसरा जो है सबसे इम्पोर्टेंट चीज़ जो है, इट इज़ ऑलवेज जो हिपोक्रेटिक ओथ है ना, उसमें पहला जो कहते हैं ना कि फर्स्ट डू नो हार्म, तो उसमें हमने बल्कि उस पर वो नहीं किया था। आई चेक, अगर मेरे पास कुछ, मैंने काफ़ी चीज़ें अपने लेक्चर से एक्सक्लूड की थी फॉर द सिंपल रीज़न कि आप लोगों को प्रैक्टिकल का ज़्यादा टाइम मिले। तो वो यार इधर ये इसमें स्लाइड शो किधर है, ये है ना, हाँ, तो ये मैं आपको एक ठहरे, हाँ, I'll just go through certain bits with you, क्योंकि हमारा ये भी होता है कि अक्सर हम what we tend to do is during micro teaching भी करते हैं ना during session, लेकिन that is mainly with, हाँ ये अच्छा, हाँ गुड ये यार लगा दो ताकि ओह यस, ये भी यार ऑफ कर दो बेटा, ये वो हो रहा है। देखें, उस वक्त भी हमने केस डिस्कस किया था, जो यंग, जो आप में से जो यहाँ बैठे थे, यंग गर्ल 21 year old who was getting abdominal pain ना, तो whether colonoscopy is indicated or not, अवल तो यह कि if it is not indicated and you do a procedure and something goes terribly wrong, तो सबसे पहले तो आप अपने आप को you can't justify, मतलब your own conscience ना, तो let's go through the indications for colonoscopy. So first and foremost is rectal bleeding, and a lot of the cases that we did here were cases with rectal bleeding. Iron deficiency anemia is, there's a very strong indication for colonoscopy in that. Because iron deficiency anemia, whenever you get a patient, तो आपको अगर मैं कहूँ कि आपने सिर्फ इसमें एक ही प्रोसीजर आपको अलाउड है, पैसे नहीं है, एक ही कर सकते हैं, then you would go for colonoscopy, OGD नहीं, unless उसके बहुत dysphagia या उसके symptoms है ना, क्योंकि most of the time the reason is कि if you do colonoscopy in that, number one, you will find a lesion, suppose you find a lesion that is treatable or curable, because colonic cancer, if it is picked early, is curable. Gastric cancer, only 10% go to resection. Gastroesophageal cancers, by the time we diagnose them, are unresectable. So that's why it's important not to miss colonic cancer. तो iron deficiency anemia का जो standard protocol है, that is OGD, duodenal biopsy to exclude celiac disease and colonoscopy, ठीक है? तो iron deficiency anemia is a very important indication, और जब में भी iron deficiency anemia उसकी mandatory है, ये नहीं है कि सिर्फ iron की गोलियों पे डाल दें। Suspicious appearance on CT or barium enema, barium enema आजकल वहाँ पे कोई नहीं करता, it's only CT colonography now. So if anything suspicious you see on CT or barium, you must do a colonoscopy, right? Assessment of Crohn's disease and colitis. There are three main indications. One is extent of the disease, the other is activity, whether it is active or not, and the other is surveillance. We'll discuss them one by one. For diagnosis, you don't need to do a colonoscopy, unless वो by chance हो rectal bleeding हो कुछ उसमें आपको पता लग जाए. For diagnosis of ulcerative colitis, all you need is a rigid sigmoidoscopy or flexible sigmoidoscopy. You just, क्योंकि ulcerative colitis, the rectum is involved in 100% of the cases. If it's a fulminant colitis, you just start treating them. Then, once the patient settles, then you do colonoscopy for extent, activity and surveillance. Extent ये होता है कि बाद वक्त colitis could be limited to the rectum, it may be limited to the sigmoid when it is called distal colitis. When it is limited to the rectum, it's called proctitis or distal proctitis. And when it is limited to the splenic flexure, it is called left-sided colitis. When it extends up to mid-transverse, it's called extensive colitis. And when it goes up to the cecum, it is known as pancolitis. Sometimes it might extend to the terminal ileum, which is called backwash ileitis. ठीक है? तो उसमें extent के लिए आप करते हो. You do it for activity. Patient comes in with bloody diarrhea, unwell. You want to find out whether it is really, or he's going to the toilet 20 times a day. So whether you want to find out whether it is diarrhea from other causes or due to flare up of his colitis. And in that case, you can do a colonoscopy, but if it is severe colitis, then you only do a flexible sigmoidoscopy with limited bowel prep and with an experienced colonoscopist, ताकि air insufflation ज़्यादा ना करे, because there is a risk of perforation. Surveillance is anyone who's had ulcerative colitis or Crohn's disease for over 10 years should have a colonoscopy every 3 years. If they have it for 20 years, they should have it every 2 years, and if they have it for more than 30 years, they should have it every year. Irrespective of how long they've had it for, if they've got primary sclerosing cholangitis with the colitis, they should have it yearly. ठीक? Happy? Unexplained diarrhea. किसी केस में भी change of bowel habits, more than 6 weeks, any age, young, old, anyone with new onset diarrhea should have a colonoscopy. And if the appearances are normal, you should take biopsies from the colon, random or targeted as indicated, right? Change in bowel habits of any duration in anyone above 60 years of age or 55 years of age, depending on wherever your cutoff point is. Colonoscopy is mandatory. Younger patients में आप नहीं करते, लेकिन in Pakistan I've seen very young people have bowel cancer, right? So, but if they've got other alarm symptoms, then you must do it. Or anyone, even if there is associated rectal bleeding, then it's definite. Screening purposes. In UK, US, many of the Western world, they have general population are screened for bowel cancer. Anyone above 55 years of age, stool sample, they are sent this testing card for stool samples, which they provide with, and it's checked for fecal occult blood. Those are sent back. If they are positive, they are offered a colonoscopy. That is for screening purposes. Anyone with family history of bowel cancer or polyposis syndrome, familial adenomatous polyposis syndrome, Lynch syndrome, non-familial, or anyone with first-degree relative should have a colonoscopy, right? So surveillance further, जो है तो previous polyps or cancers, anyone who's found a polyp which is more than 1 centimeter in size should have a surveillance colonoscopy. उसका ये होता है कि there is a British Society of Gastroenterology, American Society of Endoscopy guidelines हैं, उसके मुताबिक आप करते हो, depending on the number of polyps, the size of the polyps, right? So they should have it done. अगर multiple polyps हैं, high grade dysplasia, so you might need to do it every year or even after 6 months. So depending on what you find, IBD, inflammatory bowel disease, they need surveillance just as we discussed. ठीक है? Ureteral sigmoidoscopy. Whenever somebody who's had a bypass operation of ureter, into the sigmoid, then those are at high risk of developing bowel cancer, so they should have a colonoscopy. Anyone with acromegaly, because whenever there is a high level of growth hormones in your system, you are at risk of developing bowel cancer, and those patients with acromegaly should have an yearly colonoscopy. They are quite high risk. Contraindication, very important. First one is withdrawal of consent by a competent patient. Patient awake hai, he is fully competent, he knows what he is doing. If there is, he says कि भाई मैंने आप procedure करो, in the middle of the procedure, they say I don't want a stop. Or if he is feeling pain, okay, stop. You must stop. Otherwise, it will be termed as an assault. ठीक? हाँ, The second one is very important. Endoscopists not accredited are incompetent to perform the procedure. अगर आपकी ट्रेनिंग नहीं हुई है लेकिन आपने अपना एक आपको 40-50 लाख रुपए मिल गए, आपने अपना कोलोनोस्कोप खरीद लिया, आपने क्लिनिक में लगा लिया, आप कर रहे हैं, दैट इज़ नॉट indicated. That's right. Okay. So no, if you are not competent to do it, it's contraindicated there. Uncooperative patient would not say cannot be safely sedated. क्योंकि you can then cause a perforation or a hazard. ठीक? Important contraindication: acute severe colitis. Acute severe colitis में you never do a colonoscopy. Number one, bowel prep उसको हशर नशर कर देगा. Number two, आप जब उसको एयर भरेंगे, कोलन ऑलरेडी फ्राइबल होता है, you might cause a big tear. ठीक है? So never do it. You can do flexible sigmoidoscopy with no bowel prep or limited bowel prep, but by an experienced colon endoscopist. आपका senior जो बंदा वो करे. Acute diverticulitis. Diverticular disease is quite common in the West. We see a lot of it, and it can be hazardous for the novice, for the beginner, because you don't know whether it's a lumen or it's a diverticulum, and I've seen a lot of people go through a diverticulum thinking it's a lumen. But if you are experienced, you should okay. But if they've got acute diverticulitis, there is infection in the diverticuli, those are the cases which you can cause perforation. So if you see active pus coming or the diverticuli look inflamed, blood coming out of them, abort your colonoscopy. Don't do it, because you can cause serious harm. Even in good hands, expert hands. I never do it, right? Acute abdomen of any sort. If a patient is peritonitic, patient has got guarding, colonoscopy is not the investigation of choice. Those patients need CT scans. Okay? So don't do colonoscopy in the wrong setting, because you can make an acute abdomen worse by insufflating air and infected material inside. Perforated viscous, again, any sort of perforated viscous, whether it is perforated intestines, small bowel, large bowel, stomach, whatever, don't do a colonoscopy because it's an acute abdomen. Now, look at the last three bits in red. Colonoscopy involves those three elements which can be hazardous. Number one is the bowel prep, sedation, because sedation has got its own hazards. If the patient has got comorbid factors like he has got COPD, ischemic heart disease, they are more prone to sedation. The patient is elderly, frail, more prone to the effect of sedation. And the procedure and therapy. Procedure itself can be quite hazardous. So most of them are due to those three items, and they should be, the contraindication should be considered in the light of those three. कि भाई ये patient को renal failure है, he can take phosphate type based bowel prep or not. Whether the patient has recently had a heart attack, is he fit for a colonoscopy? If somebody had a heart attack 2 weeks ago, you don't do a colonoscopy or an OGD unless that patient is bleeding. Then there is a justification to stop the bleeding. Okay? So everywhere it is relative. Pregnancy mein beta, if there is no active indication, you wouldn't do it. You recently had a pregnant lady who came in with the first presentation of acute severe colitis. We did a flexible sigmoidoscopy, made a diagnosis, and started her on full treatment, including steroids, everything. And in fact, she is going to deliver any time now. So, but she's all right now with treatment. See? So yes, perforation, we discussed this last time. Okay, na? So basically, indication ka jo tha, that was the main thing that I wanted to go through. Oh, sorry. We did discuss, I'll just do consent with you people. Okay? I deliberately didn't, basically चक्कर ये था कि we wanted to speed things up and not make it boring for you initially. So that's why we skipped off most of the theory. So that, इसीलिए आपको 6 colonoscopy मिली है. So now we've got time, so we can do it. Right, okay. So consent. Legality of consent, the legal aspects are different in different countries according to the law of the land, right? So what is an informed consent? What are the risks quoted for colonoscopy? What about withdrawal of consent, which we discussed, and what to do and what not to do? Okay? So the informed consent is that a patient should have before you do a colonoscopy or any procedure, they should have sufficient information to understand the procedure. पेशेंट को उसके बेनिफिट्स और हार्म्स जो भी हैं सब आप बता दें, ठीक है? पेशेंट अच्छा, दूसरा ये कि आप पेशेंट को डिमेंशिया, उसको आप कंसेंट उससे साइन करा दें, दैट इज़ इनवैलिड. सो दे शुड बी एबल टू रिटेन, यूज और वे ऑफ द इंफॉर्मेशन एंड मेक अ डिसीजन ऑन द बेसिस ऑफ दैट. यूके में हम इसको कहते हैं मेंटल कैपेसिटी. और मेंटल कैपेसिटी यू कैन assess as a clinician, you can ask a psychiatrist to do it, or you can ask the nursing staff who are familiar with the patient to assess that. So those are the elements that you have to do. It should not be done under force or duress. You should not be forced into the decision, and patient should have the right to choose alternative or other procedure. वो कहे कि भाई मैंने कोलोनोस्कोपी नहीं करानी, आप मुझे कुछ और टेस्ट बताएं, तो you can offer them a CT colonography. So those are important aspects of it, and they can withdraw consent at any time. ये नहीं कि आप कहें कि अब तुमने तो अब दस्तखत कर दिया, मैं ज़रूर करूँगा. That is not the case, right? You should have a structured approach to a consent process, so that when you are explaining all these things to the patient, it doesn't take you ages to do it. अगर आप एक structured format follow करेंगे and you do that every time you do it, it is much easier and quicker to do it. ठीक है? तो ये जो है, इसका हमने एक एम्ब्रेस एक्रोनिम रखा हुआ है. एम्ब्रेस स्टैंड फॉर ई फॉर एक्सप्लेनेशन, मोटिव और वाई यू आर डूइंग इट, जो कि मतलब इंडिकेशन है, बेनिफिट्स, रिस्क, अल्टरनेटिव लाइक अदर प्रोसीजर दैट यू कैन डू, एंड कॉम्प्लिकेशन. और ई जो है तो वो साइड इफेक्ट जो है, साइड इफेक्ट्स ऑफ द ड्रग वी गिव. तो इसको आप याद रखें एंड यू कैन नॉट गो रॉन्ग. अच्छा ठीक है, राइट, ओके. चलिए बीच में फिलर टाइम जैसे मैं इनको बता दूँ, ठीक है? तो वील स्टॉप हेयर. हाँ चलें.
What time is your flight?